Good morning. Allow me to recognize Honorable Nicholas Priya, the Speaker of the National Assembly of Seychelles, Honorable Advocate Jacob Francis Modenda, the Speaker of the National Assembly of Zimbabwe, the Director for UNA's Regional Support Team for Eastern and Southern Africa, the Vice President of AFRIAN, East and Southern Africa, members of Parliament, colleagues, and the youth of this region. Honorable speakers and honorable members of Parliament, colleagues, it's with great pleasure that I'm assisting to moderate this August panel and coordinate the interactions of all participants who are about 60 plus engaging us or supporting this particular online engagement, which is termed Delivering on the Commitments of the Tshwane Declaration, an engagement of SADC national parliaments to respond to young people's sexual reproductive health and rights challenges and in needs and times of COVID-19. As it is often said, the youth of today represent the future of tomorrow. The veracity of this saying is indeed demonstrated in addressing sexual reproductive health and rights challenges, which are predominantly faced by youth in the SADC region. The capacity of today's youth will determine progress in sexual and reproductive health and rights made not only in the coming years, but in decades to come. The youth discourse is particularly relevant since the world is living in unprecedented challenges with the COVID-19 pandemic that has significantly affected youth education and development. While we get to hear more of the challenges encountered in the discussions to come or that will follow, it is recognized by international observers that it's indeed the youth who have the ability to set up current challenges and lead the world to a better place. As we engage with national parliaments today, I wish to quote the Greek philosopher Aristotle, who wrote on the youth and said, and I quote, "The fate of empires depends on the education of the youth," close quote. And the legislator should direct his attention above all to the education of the youth. For it is the youth which forges the character of the democracy. This emphasis on the youth is indeed echoed in the Tshwane Declaration, which will be the subject of today's discussions. At this point, honorable members, allow me to turn to a few housekeeping issues. You will already note that your microphones have been kindly muted, and this will be only unmuted when you are making a presentation or you are taking the floor. If there are any questions or any inputs that have to be made, kindly type your question into the question panel on the webinar below. The webinar will be recorded and the deck will be shared after the webinar. So kindly bear with us for this session. At this point, I'll quickly go through the program and introduce our key speakers. We will start with the first session where I would love to introduce Honorable Audrey Vidot, who is a dynamic young member of parliament from the Parliament of Seychelles, and who will make an overview of the Tshwane Declaration. Afterwards, the COVID-19 Youth Survey will be presented by Ms. Lorenzo Kabasele, the President of the AFRIAN, and we will get to hear the testimony from Ms. Utupele Ngonga from SG AFRIAN, Malawi. In the second session, we'll have the pleasure of hearing from His Excellencies Honorable Nicholas Priya and Honorable Advocate Jacob Francis Mudenda. Allow me to just briefly introduce Honorable Advocate Jacob Francis Mudenda. He is currently the Speaker of the National Assembly of Zimbabwe, a renowned legal practitioner and a seasoned lawyer in matters of constitutionalism and human rights. The Honorable Speaker has served as a Member of Parliament for 17 years. He is a registered advocate with the High Court of Zimbabwe, having practiced as an attorney for 13 years. We also have the pleasure to hear from Honorable His Excellency Nicholas Priya, who is the Speaker of the National Assembly of Seychelles, who is an eminent advocate of democratization and has been spearheading several parliamentary initiatives which led to youth inclusion, socio-economic development in the past years. A renowned human rights at heart lawyer who stands to defend the rights of young people, defends the rights of all that he works with across the region and in the Parliament of Seychelles. At this point, Honorable Speakers, members of Parliament and colleagues, allow me to welcome the Director for UNAIDS, Regional Support Team for Eastern and Southern Africa, Mr. Enes Chuma, who will give us the opening remarks for this particular session. I believe most of you are familiar with our speaker today. Those of you who are not familiar with the speaker, allow me to just give you a brief bio for our speaker at this point. Our speaker is a citizen of Zimbabwe. He has worked across the United Nations in several countries in East and Southern Africa. He has worked in the United Nations for over a decade thus far and is a passionate defender of systems and processes around HIV and AIDS, among others. At this point, allow me to welcome you, sir, to give us an opening remarks on behalf of the UN agencies and the partners on this team.
Thank you very much indeed. I hope you can hear me.
Yes, we can hear you, sir.
Okay, thank you, Madam Chair. Let me start by acknowledging the Honorable Advocate Jacob Francis Mudenda, Speaker of the National Assembly of Zimbabwe, the Right Honorable Catherine Gotani Hara, Speaker of Parliament of Malawi, Honorable Nicholas Priya, Speaker of the National Assembly of Seychelles, yourself, Ms. Boemo Sehoma, Secretary General of the SADC Parliamentary Forum, my fellow United Nations colleagues, and most importantly, I want to welcome the young people that are participating in this debate. On behalf of the convening United Nations agencies, I'm delighted to welcome all of you to today's online engagement with speakers of national parliaments, convened in partnership with the SADC Parliamentary Forum, the UNFPA, UNAIDS, UNESCO, AFRIAN, Restless Development, and the African Population and Health Research Center. We are gathered here today to advance the commitments set out in the Tshwane Declaration, adopted at the 46th Plenary Assembly Session of the SADC Parliamentary Forum in December 2019, and building on the extensive deliberation by stakeholders participating in last year's Youth Indaba. By adopting the Tshwane Declaration, SADC parliaments committed to several interventions, including the domestication of already ratified global, continental, and regional commitments on HIV and gender equality, international laws, policies, and programs, and to support meaningful youth engagement in matters that affect young people's lives. The adopted commitment invites for enhanced partnership that brings together parliamentarians, governments, civil society, youth activists, donors, the private sector, the United Nations development system, and other actors to mobilize all available efforts and resources for action. However, taking forward the commitments of the Tshwane Declaration into 2020 requires an analysis and adaptation to the current COVID-19 pandemic, which aggravates many of the challenges faced by young people in the region, including lack of access to integrated HIV and support, and gender-based violence, information, services and commodities, loss of livelihoods, and education opportunities, just to mention a few. Later on in this webinar, there will be a presentation on the outcomes of a regional survey on youth and COVID-19, going deeper into how young people are affected by the pandemic in relation to SRHR. In the SADC region, around 75% of the population is under the age of 35, yet people under the age of 35 are rarely found in formal political leadership positions. The purpose of today's dialogue is to place young people at the center of development and strengthen partnerships between generations. This by highlighting the importance of meaningful youth engagement and youth-led accountability for domestication of global, regional, and national commitments on SRHR, HIV, and gender equality. All of this is to be put within the framework of the globally agreed Sustainable Development Goals, including the target to end AIDS as a public health threat by 2030, in line with agreed fast-track targets. We know that the current pace of the HIV response, unfortunately, won't let the SADC region meet the fast-track targets set out for 2020, partly due to the alarming scale of new infections among young people in the region. Every week, 3,400 adolescent girls and young women in the age group of 15 to 24 years in the SADC region are infected. This is more than double that of young people, of young men, which is about 1490 per week. To change this once and for all requires steadfast political leadership, commitment to action, and accountability. Parliamentarians and youth advocates play a critical role in this respect. This includes the need to challenge laws, policies, and practices that negatively impact on young people's access to support services and information, including the alarming scale of sexual and gender-based violence, being one of the main drivers of the HIV epidemic. Parliamentarians play a critical role in this respect. You are leaders within your societies and communities, within the mandate and public trust to act in the interests of your own citizens, including to enact laws, vote the national budget, and hold governments accountable for actions in line with commitments made. By bringing all of us together here today, I wish that our engagement and voice will be strengthened and leveraged to push this important agenda forward and to make sure that no young people are left behind. Finally, I wish you the best of luck in your deliberations today. And on behalf of the United Nations as a system, we look forward to the outcomes of these deliberations, and we look forward to strengthening our partnership with you as we go forward. Thank you, Madam Chair.
Thank you very much. Indeed, that was a very thought-provoking, welcome remarks. Not surprising as Mr. Agnes Chapinga Chuma has been working with the United Nations for a long time, has worked with Ban Ki-moon, has also been able to work in the humanitarian sector. He has also been appointed as the ILO Assistant Director General and Regional Director for Africa from 2014 to 17. At heart, he's a microeconomist by training and started his profession career with the Reserve Bank for Zimbabwe. We hope that as we delve into issues of appropriation and the Parliament, you'll be handy for us, sir. Thank you very much for that opening. At this point, honorable members, allow me to welcome Honorable Audrey Vidot from Seychelles to give us an overview of the Tshwane Declaration. Is Honorable Vidot online? Colleagues, any assistance on that end?
SG, she doesn't seem to appear in the list of both panelists.
Yes, that's
and
what I realized.
Yeah, she may be offline.
Okay, do we have a replacement to assist us with the overview of the Tshwane Declaration? While we get ready, it may be helpful if we have Ms. Atupele Ngonga to probably start with a testimony, then we can roll back on the agenda as proposed. Is Ms. Atupele Ngonga online? Do we have Ms. Lorenzo Kabasele? Yes, I see. Ms. Lorenzo, do you mind taking the floor to just share the COVID-19 youth survey?
Yes, please, I do.
Apologies for that shift in the program.
All right, it's working now. It's working.
Oh, I see Honorable Vidot online.
Yes.
Oh, thank you. Apologies for that. May we kindly go back to the program as initially proposed. Honorable Audrey Vidot from Seychelles, I introduced you in absentia. If you could kindly give us an overview of the Tshwane Declaration.
SG, do you hear me?
Thank you. Yes, I can hear you.
Okay, you can hear me, that's good. Honorable speakers, honorable members, honorable colleagues, all protocol observed, good day. Honorable Vidot from Seychelles. The Tshwane Declaration of the Youth in Daba was about strengthening youth-led accountability in SADC parliaments for delivering on commitments on sexual reproductive health and rights, SRHR, HIV, and gender equality. For the information of the participants, the Youth in Daba took place in Pretoria, South Africa from the 15th to the 17th of October 2019, and it was hosted by partners of SADC-PF, UNAIDS, UNFPA, UNESCO, AFRIAN, Restless Development, and APHRC. And it was held under the theme, delivering on political commitments on sexual reproductive health and rights, SRHR. One page, inside again, SG, do you hear me?
We can hear you.
You can hear me?
Yes.
Okay. So, as I said, it was held under the theme, delivering on political commitments on sexual reproductive health and rights, SRHR, HIV, and gender equality in the SADC region through youth-led accountability. Now, it drew the participants from the following groups: young parliamentarians and young activists and professionals engaged in SRHR, HIV, gender equality across the SADC region. It provided a strategic platform for international generational dialogue between youth, young people, and young parliamentarians and development partners. The youth in Daba took stand from the fact that the SADC member states have made a strong commitment within global, continental, and regional framework to strengthen investments in young people, SRHR, HIV, and promote gender equality. Still, young people remain one of the most vulnerable groups in attaining SRHR and gender equality, not least in terms of high rate of new HIV infections, early and unintended pregnancy, and child marriage, just to mention a few. Young people under the age of 35 are rarely found in formal political leadership position and have limited influence in decision-making processes, which undermine mindful youth participation in matters that affect the lives of our young people. Arising from extensive deliberation by the stakeholders participating in the Youth in Daba, GIAD presented the Tshwane Declaration to the 46th Plenary Assembly session of the SADC PF in December 2019, where it was unanimously adopted. By adopting the Tshwane Declaration, SADC PF committed to a number of interventions, including to domesticate global, continental, and regional commitments on SRHR, HIV, and gender equality into harmonized laws, policies, and programs, with particular emphasis on issues pertaining to adolescents and young people's development and their access to universal health coverage, UHC. To amend and where necessary, revoke laws and policies that limit the freedom of expression and choices of young people, be as they negatively impact on young people's ability to access integrated SRHR, HIV, GBV services, comprehensive sexuality education, CSE, social protection, and harm reduction services, including for the most marginalized and key populations. Thirdly, to enhance the knowledge and the capacity of young people in order for them to advocate for SRHR, HIV, and gender equality within national development agendas. To provide young people with platform to effectively influence legislation and policy reforms, and to advocate for adequate and sustainable allocation of domestic resources that are proportionate to the population size and needs of our young people, so as to accelerate implementation of national programs at scale. Through accountable parliaments, the socio-economic challenges of our youth, the and be effectively addressed, including by introducing gender-sensitive, inclusive, integrational of young parliamentarians in existing parliamentary structures that will be the legitimate voice of our youth across the SADC member states in line with the SADC PF Youth Development Program 5-year strategic plan. And last but not least, parliaments using their legislative oversight and representation mandate should ensure that executive delivers on their commitments to sexual reproductive health, HIV, gender equality for adolescents and youth as listed above. Taking forward the commitments of the Tshwane Declaration, the adopted commitments invite for enhanced partnership to mobilize all capacity and resources. The purpose of today's webinar is to identify key intervention to accelerate the implementation of the Tshwane Declaration with national parliaments through the political leadership of our honorable speakers, and responding to young people's need and challenges exacerbated by the COVID-19 pandemic. We should take full advantage of this unique platform to robustly engage with the decision makers and ensure the enhance of youth accountability. And I thank you for your kind attention.
Thank you very much, Honorable Vidot. Thank you for that, unpacking the Tshwane Declaration for us. At this point, allow me to invite Ms. Lorenzo Cabasel, the President of AFRIAN, to share with us the COVID-19 youth survey that was conducted.
Sorry, I was on mute. I was saying thank you very much to everyone. I'm going to put on the presentation on the screen so everyone can have the possibility to see the presentation while I'm presenting. Hello, I don't know if we can see the presentation. Hello.
Yes, we can see the presentation.
Okay, thank you very much. During the COVID-19, we wanted to have young people say. So we did a survey in partnership with the Result Development, UNAIDS, UNESCO, AFRIAN, APHRC, to have young people responding on the needs of, on their needs during the COVID-19 epidemic in Eastern and Southern Africa. So, sorry. First of all, we had a total of 174 young people who participated, who responded to the survey, to the questions, and 77 were females, 93 males, 1 transgender, and 3 others. And this survey was responded by, we had the participation of 19 countries that responded to the survey. So the data analysis was led by youth themselves, and the data was analyzed by African members from Rwanda, DRC, and Namibia. And this was in collaboration with the Result Development and APHRC, who helped us in data analysis process. So in this survey, the key findings that our fellow young people gave was the restriction of movement, deprioritization, and the disruption of sexual reproductive health services have impacted their access to SRH services among them. There was also an accelerating risks of violence, abuse, and exploitation in our communities. Also, young people are worried about losing their jobs and income because we are in lockdown and everyone is home, they are not working, and the income is coming down. So they are worried of losing their jobs. And the COVID-19 is also affecting the mental health of young people due to that worry and uncertain of education continuity, existing empowerment and economic impact on their families, because no one is going to work, and they are worried on this being impacted by the whole family. So apart from that, there are some challenges that young people are facing, our fellow young people are facing in access of informations and services regarding their sexual reproductive health and right. And this is due to limited access to information regarding their sexual reproductive right, services, supplies, and support. Because of the restriction of movement as we're in lockdown, the movement is restricted for us to go out, that you have to go out. But also public health cares are closed during this lockdown. The priorities now of resources are all oriented by the COVID-19, and sexual reproductive right and health of young people is not now a very big priority, even if some partners like UNFPA are supporting that part, but it's no longer like a very big priority to mostly the government. So like a friend of mine went to a hospital or to a clinic to have some contraceptive, and the first question that she was asked, that is she having sexual activity during this outbreak? Like the young person was stigmatized. She went to get the services, but she was stigmatized, saying that it's lockdown and you can't have this sexual activity during this time. So it makes young people to be really affected during this time. So the young people themselves, our colleagues, came up with recommendations so we could bridge down this access gap to sexual reproductive right and sexual reproductive health and right information and services among adolescents and young people. And here are some recommendations. First of all, our fellow young people recommended that we should have online services delivery of sexual reproductive health and right commodities such as contraceptives. We know we have some applications that have been worked by many partners. I know UNFPA has one of applications that young people could easily have access, and we have youth-led organizations that have applications, but that could really be put online so that young people during this time could have access to services, but also identify and train healthcare workers and monitors so they can reach out to young people through telephone for counseling. And we could have a green line where young people can call those health workers so they can have counseling during this COVID-19. But also the use of interactive radio session, educate to have education with our fellow young people on sexual reproductive health and right, to have radio broadcast with them and exchange with them during this critical time. And also use to have clinics that can use the database that they already have to reach out to vulnerable young people, for example, young people with disability and LGBTQ. So we can use those data so we can easily reach out to young people for their services. But also young people mentioned that it was necessary to establish the establishment of satellite facilities for sexual reproductive health and rights services, so young people can easily have access. For example, we know during this COVID time, there are some facilities that they have put in hospitals and clinics where people can easily go for treatment and tests. So that's also those facilities that we would like to have for young people's access to services regarding their sexual reproductive health and rights. But also, young people recommended that we have to do more advocacy, and I'm happy that we have parliaments inside. So the government could also get the issue of sexual reproductive health and rights services as essential during this this lockdown. So we should not neglect the part of access of young people to have services regarding their sexual reproductive health and right. So from there, young people also came up with some solution on how we could provide psychosocial and mental support, messaging and services during this lockdown. And one of them is to have a WhatsApp bot. We know WHO has put on a WhatsApp bot where you can easily ask questions on everything regarding COVID-19. And it will be necessary for us to have a WhatsApp bot for issues regarding sexual reproductive health and right for young people, so they can easily have informations in regarding their sexual issues. But also to have virtual counseling services, as from mentioning people who are well trained on that, so we can have virtual counseling, and also have animated videos. We know there is some existing, but if we could also have more animated videos, so regarding issues of young people, sexual reproductive health and right, so they can easily have access to information, and engaging mental health experts in designing messages of COVID. So we know we have some text that we get from telecommunication industries, and if we could have experts who can also share on can help in those messaging. So
Kindly
we
round
wanted
up.
to know, yes, hello?
Kindly round up.
Okay, yeah, I'm almost at the end. So we wanted to know how young people would like to receive information about COVID, and some things came out like social media, where they can easily have information, Facebook, Instagram, engagement with influencers, youth dialogue, and free hotlines. So apart from people really want to be in the dimension of the spread of COVID-19, so we can have what they want to volunteer in this work as volunteers, but to have also a youth COVID-19 task force that work closely with the government and other organizations to prevent the spread of COVID-19, but also work collectively to fight misinformations, like young people, most of them don't think that they can spread COVID-19 or they can die from COVID-19. So it would be great so we can be involved. But how can we support our fellow young people in preventing the spread of COVID-19 is by working closely with telecom operators to provide a special data plan package, online short courses, but also have a platform to share experiences on how to manage quarantine and social distance, because this is affecting, and also the provision of temporary Wi-Fi hotposts. So to wrap up, we have young people suggested some alternative forms of education opportunities for them during this close of school and universities, and that was radio stations and TV stations where we can provide and promote, support local created technologies that can support the online education of the young people. So yeah, this is what young people brought out from the survey, with the help of all partners that I'm from mentioning: UNFPA, UNESCO, UNAIDS, Result Development, and AFRIAN, who work together to bring this out. Thank you.
Thank you very much. Ms. Lorenzo Cabasela is a national of the Democratic Republic of Congo. She graduated with computer science and is very passionate in putting forward policy-related issues for young people. Thank you for that presentation. If we look at our time, we have actually gone beyond the time proposed for this particular session by almost 11 minutes. If I may, at this point, invite Ms. Atupele Ngonga from AFRIAN Malawi to give us a testimony. Do we have her online?
Madam Chair, I don't see the young person online.
Okay, apologies for this. I think at this point we may proceed to our next session, and unless we have a representative who could give a testimony in place of Ms. Atupele Ngonga. Okay, may we kindly proceed? I would now like to hand over to Ms. Primrose, who is a global network building manager from Restless Development, and she is also committed to shaping and practicing advocacy-related, activities with young people. Has worked across 45 countries in the SADC region, and she will be taking over this session, which will be an intervention by honorable speakers of parliament from the Seychelles and Zimbabwe. Honorable Catherine Gotani-Hara could not participate. It was unexpected because of the presidential elections happening tomorrow in Malawi. The honorable speaker got tied up to national priorities. We hope to have her in some of our sessions as we move forward. So the honorable speakers that we have on board, we have from Seychelles and Zimbabwe. Thank you very much, Primrose. Thank you, honorable speakers and honorable members of parliament. We now are getting into the meat of this particular intervention. We look forward to a very interactive engagement with the audience as we examine the impact of the Tshwane Declaration on youth and discuss some SRHR challenges that youth are particularly experiencing in this period of COVID-19. Thank you very much, Primrose, and all the best.
Thank you so much, Poyamo, for the kind introduction. It is my pleasure to moderate this session. So I'll start by saying all protocol observed. So within this session, we will gently ask you, honorable speakers, to reflect on your country-specific contexts in light of the commitments that were made in the Tshwane Declaration adopted by the SADC-PF 46th Plenary Assembly in December 2019. We will ask your interventions to reflect on the challenges and focus on proposing feasible solutions aimed at advancing the Tshwane Declaration. So I will start with you, Honorable Advocate Jacob Francis Mudenda, Speaker of the National Assembly of Zimbabwe. Let me start with appreciating the progress made by the government of Zimbabwe in ensuring the fulfillment of the sexual and reproductive health rights of adolescents and young people. Indeed, I mean, as a Zimbabwean, I will attest that Zimbabwe has very strong HIV and AIDS policies and strategies that increase and facilitate access to services, including HIV counseling and testing, prevention of mother-to-child transmission, and access to ARVs by all, including adolescents and young people. Moreover, another positive indicator is the mandatory inclusion of HIV and AIDS education in primary and secondary education institutions. However, our review of the national legal framework of the country shows that there are no existing provisions that explicitly grant adolescents the right to access contraceptives, including condoms. It is of utmost importance for the growth of a country to ensure the ability of their young population to prevent life-derailing obstacles like teenage pregnancies, just to mention one. The evidence is overwhelming. When we look at statistics on HIV incidence among youth and teenage pregnancies, Honorable Speaker, we would like to hear your thoughts on this matter. Specifically granted access to adolescents to sexual and reproductive health rights services, in particular contraceptives. Is Parliament planning to work on a bill that would have clear references to the ages of consent to services without parental consent? I mean, that was a very lengthy question, so I'm also very happy to rephrase for you, Honorable Speaker, if the case may be. But over to you, Honorable.
Thank you very much, Primrose. The greater part of my contribution has been summarized by yourself. What is required at the moment, perhaps, is to inform this platform that through our portfolio committee on health and child care, since the last 18 months, the committee has been involved in investigating the issues of access to SHR by our youth throughout the country, with a special reference to secondary school children and as well as tertiary institutions. There has been also involvement of the adult population, where we have some responses that are a mixed grill. Some parents are of the opinion that the sexual reproduction education should not allow the use of contraceptives. Rather, the key issue is to appeal to celibacy of the youth, as was the case in the past, where virginity was a virtue acclaimed among young people of the African stock. There are others who are liberal, who say because of peer pressure groups, the use of the internet, which exposes our young people to all sorts of information regarding sex, have indicated that it is important that we should, in fact, engage the youth in sexual education. I am pleased to inform you that, contrary to what you said, there is a legal framework now where we have had the education bill that has clearly pronounced itself that sex education should be part of our curriculum in the primary, secondary education up to A levels, and this must proceed also beyond A levels studies. This is also buttressed by our own constitution, which was adopted in 2013, which calls for the respect of the rights of the child, as well as the right to sound health care. Now, with this constitutional grounding, we believe that Zimbabwe is on right footing as far as the promotion of the SHR and the question of HIV and AIDS issues that affect the youngsters. I want to inform you also that Zimbabwe's parliament has a youth parliament which meets at least once a year in Harare, the capital. Now, this is in response to the Tshwane Declaration, which emphasizes youth accountability. In other words, engaging the youth with decision makers. During the youth parliamentary sessions, virtually all ministers are invited to answer questions pertaining to the challenges the youth are facing, including sexual education rights. And we found this quite refreshing, and the sessions are attended not only by the ministers, but officially opened by the head of state and government, the president himself. As regards the pandemic challenge at the moment, I would like to inform the platform that all health services have been declared essential services, and our youth have got right of recourse to these health institutions. Our parliament also encourages the youth to petition parliament on issues that affect them in terms of section 149 of the Constitution. And we have had some excellent propositions coming to parliament on issues that affect our youth. And we believe that we are on course in mitigating the challenges that our youth are facing. But let me emphasize one thing. The SG in her opening remarks indicated that the youth are the future. I think we need to correct this. the youth are the present and the future. I say this because if you are going to promote youth accountability, where you simply want to engage decision makers, I feel this approach is inadequate. What is important is that the youth must be engaged in the decision-making processes rather than receive what the decision makers are saying. So inclusivity in the decision-making process must be the cornerstone of engaging the youth in all issues that affect them, including health matters that are quite pertinent to them. And then let me also mention one big contradiction that as Parliament we face. On the church front, we have churches that do agree with the legislation that we've passed concerning sexual reproductive education, which also addresses the issue of abortion. Some churches agree that the youth must be assisted, medically to abort in circumstances where they feel it is necessary to do so. However, on the contrary, the Catholic Church is averse, very strongly averse to aborting. And you have these contradictions, therefore, in the church sector, which create some stumbling block as far as the legislative agenda of Parliament is concerned. These contradictions, I think, need to be attended to so that there is common vision and understanding on the problems that face the youth as far as sexual reproductive health and rights. Thank you.
Thank you so much, Honorable Advocate Jacob Francis Mudenda, Speaker of National Parliament for Zimbabwe. Indeed, I would like to greatly applaud the government of Zimbabwe with regards to tremendous progress that has been made with regards to ensuring comprehensive sexuality education in the country. And the progress as well with regards to ensuring safe abortion for all young people. As a Zimbabwean, I also truly understand how this is a very contentious issue. So we really applaud the efforts you have made with regards to addressing that. Perhaps I will take you back to just one last part of the question, which I am presenting obviously on behalf of the young people. They would really want to also know what the government of Zimbabwe, particularly the Parliament of Zimbabwe, is planning to do with regards to age of consent. Is there a plan to work on a bill that would have clear references to the ages of consent to services without parental consent in the country? Over to you, Honorable Speaker.
The question of age of consent has remained very problematic, and it is one of the assignments that has been given to the Portfolio Committee on Health and Childcare, working together with our Portfolio Committee on Justice, Legal and Parliamentary Affairs, so that the two committees should have very grounded conversations and come up with recommendations to address that issue. It still remains a very, very contentious issue. And to the extent that others feel is a contradiction in terms of the Constitution, which says the age of majority is 18 years, and therefore 16-year-olds are not majors to take decisions on their own. And this contradiction, which also does impact on the cultural implications, where some cultures do allow marriages of youngsters as young as 14 years. And this also has created some problem. But we believe that as long as the conversation takes place, we should find each other and come up with some compromise that is grounded on some legal framework. It may also need perhaps a relook at our constitutional provisions on the age of majority as they stand now. While I'm having the floor, there was also the question of mitigating COVID-19 for the youngsters. I want to inform this platform that Zimbabwe government has set aside 17 million Zimbabwe dollars as grant to the youth for their businesses that have been affected because of COVID-19. The distribution has started of that grant. Each province is allocated 1.3 million Zimbabwe dollars. That is 8 of them. Harare and Bulawayo are each being allocated $2 million to mitigate on the effects of COVID-19 as far as the empowerment of the youngsters is concerned. Thank you.
Okay, thank you so much, Honorable Speaker. To the audience with us in the House, I will call on you to type in your questions that you may have for Honorable Speaker. Please do identify yourselves by name, your organization, your country, and which Honorable Speaker your question is directed towards. We will try as much as we can to read out all the questions that come through the chat box. And also, if our time allows, we will also allow some of you to actually say out your questions directly. So please do type them in the chat box. And again, identify yourselves by your name, your organization, your country, and who you're directing the question to. And to my honorables, I will just say that I will come to you, Honorable Nicholas Priya, just now, but just to flag that we'll have a third overall question that's directed to both of you after Honorable Nicholas Priya actually responds to his question. So to you, Honorable Nicholas Priya, the Speaker of the National Assembly of Seychelles, it is important to acknowledge the efforts of the government of Seychelles in enacting progressive legislation in support of adolescents' sexual and reproductive health rights. For instance, the national legislation sets the age of consent to sex to 15 years, which is surely in line with the most recent evidence of the median age of sexual debut in the country. However, young people are under the age of 18, who are under the age of 18, still need parental consent to have access to contraception, except for condoms, even in cases where they have already had children. We acknowledge the fact that this discrepancy has been the subject of a discussion which started in the early 2000s and which culminated in a debate at the National Assembly in November 2014. However, we are unsure of the concrete action following the debate. With the worrying statistics on teenage pregnancy rates in Seychelles, while acknowledging the efforts of the government to tackle the issue, would like to ask you, Honorable Speaker, to share with us your thoughts on this matter and confirm the existence of a plan to harmonize legislation to remove the third-party consent in relation to the access to contraceptives by adolescents in line with the age of consent to sexual activity stated at 15. Over to you, Honorable Speaker.
Thank you. Thank you, Ms. Primrose. Madam S3, Honorable colleague Speaker Munenda, parliamentarians, and Mr. Tshuma, the Director of UNAIDS Regional Support Team, and everyone who's actually on board and following the panel discussion. I would like to start by saying that it is a common fact that universally, the HIV epidemiology and social dynamics keep changing, and Seychelles has not been spared. Recent studies reveal that HIV occurrence in Seychelles is mainly concentrated among injecting drug users and men having sex with men. Studies have also indicated that the youth are engaging in sexual activities at a much earlier age, and at least 50% are having unprotected sex, leading to teenage pregnancies and a risk of contracting HIV and other STDs. Such results have intense implications for a small population. This has over the years led the Ministry of Health, civil society organizations, and members of the Parliamentary Committee on Communicable Diseases, HIV, AIDS, and SRHR to work on a program to tackle issues of relevance to HIV, AIDS, and SRHR at a national level. It is imperative for the country and members of Parliament to seek public opinions on programs of awareness and sensitization towards HIV/AIDS in adolescents and their SRHR issues. This will result in informed decision-making leading to the amendments and harmonization of relevant legislations. Now, if we look at the issue at hand, Seychelles has made progress in addressing policy, legislation, and national strategic and operational frameworks that promote adolescent SRHR issues. Over the years, a lot of effort has gone into trying to better understand and support these issues. However, since most of them are still taboo, it has not been easy to reach out and change the mindsets of our population. Parents, teachers, counselors, religious leaders, and even legislators remain divided on certain issues revolving around HIV, AIDS, and the sexual reproductive health and rights of adolescents, especially on the issue which is the disparity between the age of consent to sex, which is 15 years old, and the legal age to access contraceptives, which is 18 years old. And this also applies to access to condoms. While many adolescents have free access to condoms, it is, however, mostly being done without parents' authorization and knowledge, and discussions are now rife on how to bridge the gap between the age of consent and access. It is worth noting that the legal age of marriage is also 18 years. Since the increasing rate of teenage pregnancies and prevalence of HIV/AIDS and SRHR issues are growing concerns in Seychelles, it is true that this disparity has been a subject of intense discussion, which started in the early 2000s and culminated in a debate in the National Assembly in 2014. Following this, the Ministry of Health, the National AIDS Council, legislators, and several civil society organizations, including the Youth Action Movement, joined forces to address these burning issues, but to no avail. The population was just not ready to openly talk about these sensitive issues. In 2015, when the National Assembly of Seychelles decided to partner with the SADC-PF under the SRHR governance project, it seemed like discussions geared towards SRHR would pick up. However, this was interrupted by legislative elections. Fortunately, the Sixth Assembly assumed continuity of the project and went ahead to appoint a new committee on HIV/AIDS and SRHR in 2016. This National Assembly committee immediately engaged itself to efficiently and effectively work with the Ministry of Health, the National AIDS Council, civil society organizations, and other key stakeholders. After several meetings and consultations, the committee organized 2 public hearings under the theme, Breaking Legal Barriers, in 2017. These hearings were aimed to provide a platform for open discussions about the issue of HIV/AIDS and SRHR, focusing on the disparity between the age of consent and access to contraceptives, SRHR services, the intravenous use of drugs, which is leading to the increase in HIV/AIDS and hepatitis C, the needle exchange program, as well as the issue of MSM. It was understood that by feeling the pulse of the population in mobilizing several groups, these adolescents and adults would represent the voices of a cross-section of the population and thereby assist in finding permanent solutions. This would also contribute towards achieving the goals of universal access to reproductive health and HIV prevention, treatment, care, and support. Provide support to local laws and policies, strengthen existing systems, increase access to and use of quality services, increase community awareness on the issue of HIV/AIDS and SRHR, and attract widespread media attention. But since opinions received clearly indicated that the adult population was not yet ready to accept changes in legislations, it was decided to meet again with stakeholders to re-strategize on the way forward. Discussions took place in July 2018, where members of the Committee for Communicable Diseases, HIV and AIDS, and SRHR met with the HIV/AIDS support organizations, HASO, the National AIDS Council, NAC, and the National HIV/AIDS Prevention and Control Program of the Ministry of Health to further discuss on issues relating to harm reduction, universal access to healthcare, and removing legal barriers. The aim of the meeting was for the parliamentarians present to amass expert information from these professionals to enable them to formulate 2 comprehensive motions to be tabled in the House. This meeting was followed a month later by a forum organized jointly with the Committee of Women Parliamentarians in collaboration with SADC-PF. Once again, the youth views were sought through both deliberations and by filling an anonymous questionnaire during the workshop. These were reviewed and analyzed by the committee to enable members to continue work on the relevant motions to be presented before the House that will culminate in amendments to current legislations governing the issues of HIV/AIDS and the sexual reproductive health and rights of adolescents. However, again, there was an outcry that parliamentarians were trying to force sexual activities on adolescents by encouraging them to use condoms and by facilitating access to other forms of contraceptives and SRHR services without parental consent. This led to another dormant stage in the process of presenting the motions to amend the laws. The Parliamentary Committee earlier this year made another attempt to organize a capacity building workshop, this time for parliamentarians themselves, but facilitated by stakeholders. We believe that MPs should also be adequately versed with the issues at hand so that they will not stand divided when motions are presented. Unfortunately, this time round, it was COVID-19 which canceled the workshop. Now that the country is COVID-19 free, the workshop is being rescheduled and we expect the motions to be presented before the House before September of this year. This brief on the situation in Seychelles clearly highlights the division that we still have in our society to provide adolescents and young people with access to contraceptives and SRHR services without parental consent before the age of 18. As legislators, it is our duty to ensure that adolescents have access to appropriate information and are covered by laws that provide for a safe and healthy life. There is a need to break the barrier of fear that teaching youths about sex and providing them with contraceptives will lead them to practice sex. This is a belief. It will lead them to practice sex prematurely. But we all know today, we are all aware that adolescents are having sex and it is really impossible to stop underage sex. So what do? We should provide them with the necessary precautionary measures and enact laws to remove any disparity and also to protect them. The Seychelles Parliament remains committed to the United Nations conventions and protocols that we are a party of, and we also remain committed to harmonize our legislation on HIV/AIDS and SRHR and ensure that we are in conformity to the SADC states. And to conclude, I would just like to add that during the 1-month restriction due to the COVID-19 pandemic, all existing services relating to access to treatments under the HIV/AIDS and SRHR program continued without interruptions. This was made possible by the protocols put in place by the Department of Health. I thank you.
Thank you very much, Honorable Speaker, and detailed and comprehensive response. Again, to our attendees, I call on you if you have specific questions for Honorable Speaker Nicholas Priya to type them in the chat box, identifying yourselves by name, your organization and country, and then who you're addressing your question to, so that we direct it to the right person. To both of you honorables, I have a third question actually that I would want to pose to you. After that, I will also give you questions that have come in from the chat box. From our speakers, but that will be after you both get an opportunity to respond to this third and final question. So back to you, Honorable Speaker Advocate Mudenda. We have a third question here. Whether you are, this one will be very brief, I promise you. So are you aware of any harmful traditional practices happening in your country? And if yes, do you feel the need for interventions, both legally and any other interventions you may think of? Over to you, Honorable Speaker Mudenda.
Thank you very much, moderator. I am aware of some what you may call harmful traditions, like the mutilation, the genital mutilation in some of our tribes in Zimbabwe, and these cultural practice is, I think, phasing out in view of the generation gaps that have come through, whereby the impact of education has somehow discouraged that practice, particularly where you have parents who are have been educated, and also the girl child who has been educated to the extent that they disabuse of this practice. So this practice is now on the wane, I must say, to the benefit of the girl child. and the girl child's integrity. Thank you.
Thank you very much, Honorable Jacob Francis Mudenda. So I will throw the same question to you, Honorable Speaker Nicholas Prayer. And to the attendees, I will also ask if you have any other questions for Honorable Speaker Nicholas Prayer. Please do type them in the chat box, as I only see questions that are directed towards my fellow, Honorable Speaker Mudenda. So please go ahead and respond as attendees also type in questions for you.
Thank you. Well, our situation, I think, is quite different here, and we are moving to modernize the different laws and so on. If I take it where my colleague speaker ended with regards to the girl child, we have modernized legislations to protect the girl child, and though we are still in the process of redoing the civil code and so on, the girl child is protected now, and we are even removing this law under the civil code where below 18, parents can actually give consent for a girl for marriage to take place. So now we're saying, no, we have to harmonize that. You are deemed an adult at 18, so it's only 18 onward that you can actually go into marriage. So we're dealing with that. But we do get other issues. This issue of such matters being a taboo, it's because of it's mainly because of the religious background, the way we've actually grown up. At one time, maybe 95% of the population was Catholic, and we all know the practice and the beliefs of the Catholics. But now that other religions have actually come in, there seems to be a more liberal way of thinking. And we hope that when we actually tackle the issue, then we as parliamentarians, because we will be the ones who would actually debate. But of course, we need to go out there and find out from the public, from different stakeholders, their different opinions again and again before we tackle that. Definitely, we will be looked at in so many different ways, whether we are for or against. But I think it is important because having the age of consent at 15 and having the age of access to contraceptives at 18, we need to do something. We need to try and either we raise the age of consent and we bring the age of access to contraceptives somewhere in between, in the middle, where both can actually meet each other. But this will be up to the parliamentarians also on the floor. Now, I'd just like to bring something in at the moment. The access of social media to youngsters, to teenagers and so on. This has culminated in a situation in Seychelles that we never thought we would actually encounter, where you've got predators out there on social media pouncing on young girls and young boys and so on. What used to be something common for big countries, now it has actually come to our shores. And we just had a first case where 3 adults have actually been convicted for using Facebook to lure young girls as young as 13 and 14 into sexual relationships. And the 3 men, they've actually lured between 75 to 100 young girls, and by using Facebook. So these are other things also that will actually come into future discussions. I thank you.
Thank you very much, Honorable Speaker. Your responses started making me want to move to Seychelles, actually, and be a citizen of your country. Well, so I have a couple of questions here. Please forgive me, I'll just use my tablet to just ask the questions. It seems that there are more questions for you, Honorable Speaker Advocate Jacob Mudenda, compared to Honorable Speaker Nicholas Prayer. So I will just read out 3 questions we managed to pick and maybe get your response, as I also then collect questions for you, Honorable Speaker Nicholas Prayer. So we have a question here from Rose Kamariza. Dr. Rose Kamariza is from UNFPA Burundi. She would like to thank you, Honorable Speaker Mudenda of Zimbabwe, for the involvement of young people. She says that it is quite advanced, and often texts on access to sexual and reproductive health services exist, but they are not applied. What about Zimbabwe regarding comprehensive sexual education in primary and secondary schools? So basically she's asking if there are any challenges in the actual implementation of the frameworks in favor of comprehensive sexuality education in schools. Considering that we actually acknowledge the power that Parliament has, their oversight role in seeing the implementation of laws and the enaction of laws. And then there's also a second question. So it says, my name is Honorable Tatenda Mavetera, MP Zimbabwe. My question is to the Honorable Speaker for Zimbabwe. A follow-up on the harmonization of the age of consent. Which is the best way to ask from the people, or to have a law that will be followed through? Will you not hit a brick wall by having different socio-religious contexts, which will not allow you to come to a conclusion? Which is the best way out on the edge of consent? So that is the second question. The first one was looking at implementation of CSE frameworks within the country. And this one is looking at challenges that are, brought forward by different, socio-religious backgrounds, and how you will navigate this. And then the final question, which I will pose to you from, I'll try to read this out, pardon me, Kondanani Lanford. So to Honorable Speaker Mudenda of Zimbabwe, I would like to understand from you, say, in your contribution, you have said that you have set aside 17 million Zimbabwe dollars to mitigate the effects of COVID-19 to the youth of Zimbabwe. Now my question is, what measures have you got in place to make sure that the funds really reach the targeted the intended recipients? And how sure are you that the funds will also benefit young people who are in the typical areas, uneducated, and surely lack representation to regional level or even local level? Yeah, so I will pause there, because another question is directed to you both, and allow you, Honorable Speaker Advocate Jacob Francis Mudenda, to respond. Over to you, Honorable Speaker.
Thank you very much. On the application of sexual education in our schools, I'm happy to report that after some intense debate in the National Assembly, as well as in the Senate chamber, both houses agreed to a clause that demands the teaching of sexual education in our primary and secondary schools right up to A levels. And we believe this will impact also in our tertiary institutions. That bill has now been assented to and signed by the President into law. what remains now is to ensure that the teachers in our institutions actually carry out that responsibility with the greatest zeal. But the legal framework is now there, and through our portfolio committee on primary and secondary education, we will ensure that public hearings do take place into the various provinces to assess the application of that legal framework. On the second question, which presupposes that we might hit a brick wall. There have been brick walls in our legislative agenda since time immemorial, but somehow humankind have found out some way forward. I have no doubt that in this particular case, through some extensive consultations with the world of academia, traditional leaders representing our cultural heritages, we should be able to come up with some common position. And may I also venture to say the Inter-Parliamentary Union is also seized with the matter from a global perspective. And I believe ideas coming from the Inter-Parliamentary Union should be able to inform the people of Zimbabwe through their parliament as to the best way to achieve consent on the age of consent, sexual consent in Zimbabwe. The third question, targeted groups. The Deputy Minister of Youth has been assigned that responsibility of dispersing the funds. In every district, we have youth officers under the Ministry of Youth. It is these youth officers who come up with the data, which is sifted by the Ministry of Youth under the specific direction of the Deputy Minister of Youth. And we believe the information, excuse me, the information that has been given to us is fair, equitable in terms of the sharing of this grant. And we will also, through Parliament, engage and invite any groups of youth in any province who feel they have been sidelined in getting this grant, and remedial measures will be taken to ensure that corrective action is put in place so that there is equitable distribution of this fund. Thank you.
Thank you very much, Honorable Speaker. It's quite impressive how you were very prompt with your responses. So I will come to you, Honorable Speaker Nicholas Prayer. Just as a point of clarification, some of the questions that I will address to you have been addressed to you both. So Honorable Speaker Advocate Mudenda, if you feel like you have something that you may want to add on that specific question, please do flag to me and I'll give you the flow. So Honorable Speaker Nicholas Prayer, here are a few questions. Also just a disclaimer that we are getting so many questions actually. So we are left with about 15 minutes 15 minutes to actually respond to these questions. Please try to be as brief as you can so that we get as many responses as we can. So we have Pedro here, Pedro Maumane from Mozambique. He says he's a focal point of AfriYoung in Mozambique. And then he's asking how he gets around with the confinement as there is not the entrance of feminicide in the homes, since people are now in quarantine. What is the position of lawmakers here? I'm assuming that is your position. Perhaps his question is referring to the confinements that are caused by lockdown and their lack of access to services and what lawmakers can do to actually intervene. Let me ask another question. So this is coming from Dr. Maggie, a young researcher from APHRC. She's saying that COVID-19 has shown how important research and evidence is in making informed decisions and action plans, even for young people in SRHR. However, sub-Saharan Africa is lagging behind in investment in research, despite member states' 2006 AU commitment to increase research investment. How do you ensure that, just one second, sorry. How do you ensure that there's a commitment, these commitments are taken up to ensure evidence informed decision making on SRHR? And then the final question is actually coming from my comrade from SADC PF, Tshwane Declaration, who's part of the SADC PF Secretariat. His question is for both speakers. And then he's asking, he would want to start by appreciating the critical observation by honorables, particularly Honorable Mudenda, that young people are the present and that they should be involved in policy making in addition to accountability. That feeling is mutual. In view of the above, what are the opportunities within Parliament for young people to participate in policy making and accountability? I'll summarize these questions. One of them is confinements due to lockdowns and the restrictions that is posing on young people and what Parliament can do actually to address that. The second one is on increasing investment in research. What has been done? What still can be done to actually increase investment in research? And to both of you, the question from Tshwane Declaration related to opportunities within Parliament for young people to participate in policy and accountability. I will allow you, Honourable Speaker, to respond to those questions, and then we'll briefly come back to you, Honourable Speaker Mudenda, to talk about opportunities of engagement within the Parliament of Zimbabwe. Over to you, Honourable Speaker.
Thank you. Thank you. I'll try to be as brief as possible. In Seychelles, we did not have a total lockdown during the 1 month, I would say, between the 10th of April and the 5th of May. It was restrictions. Which actually involve other stakeholders, termed the services, such services as essential services. So they were not locked down because the youth still had access to whatever services they were using, and there was no such interruptions because after 6 p.m. The only problem would be, for example, if we're talking about the problem of that youth will probably encounter after that, but the offices, the telephone lines will remain open so that they can actually get in touch and try and sort out. But all relevant backing, I would say, remained functioning. So we didn't really encounter many problems with regards to that. With regards to the certain services that provided, the only thing that changed was the way of doing things changed, because we were encouraged to wear masks in certain places, like health care workers. Sanitization became a daily norm. And also, especially at the health centers, there was this the system of putting tents outside so that you can actually start analyzing or diagnosing outside for anybody who might have the symptoms of COVID-19, and then they would be put on the side and treated in a different room and so on. So I mean, other services run, but health services, like certain operations that were not deemed urgent, were actually postponed to allow the limited facilities to concentrate on the pandemic. Now, I'd like to respond with regard to youth participation. Unfortunately, this is one of my dream, but I don't think in this sixth assembly I can actually achieve that, because apart from Honorable Audrey Vidot, who is next to me now, we don't have youth as such representatives in the National Assembly, and also the number of women also are very, very low. But it doesn't mean that the youth, they don't have a voice. We've got what we call the National Youth Council, and under the National Youth Council, we have also the National Youth Assembly. And I'd like to share with the panel and everyone listening, we've given certificate to the 16th cohort last Saturday, and we've welcomed the 17th cohort. That's a group of 45 youngsters between the age of 15 to 18, 19, and they form a Youth National Assembly, and they can actually bring motions and actually take the results of the motions or recommendations to the government. So they have a voice, and they are also, we've got a very good relationship between the Youth Assembly and the National Assembly, the actual National Assembly. So they have a voice and they can be heard. I was present at the ceremony last Saturday, and I met also with the new speaker. And of course, with the outgoing cohort, we had a very good relationship, and now I've welcomed the new speaker and the new team for a meeting in the near future. And again, to listen to their aspirations and so on, and also to see what they have in terms of contributions they can make. So whereas research in terms of research for COVID and all that, we don't have much in terms of local research and so on. We depend a lot on we're a very small country, very small population, and the capacity is actually limited. So we don't really go into research, but we depend on medicines from overseas and other facilities also from overseas. I hope I've been able to clarify a few points. Thank you.
Thank you, Honorable Speaker Nicholas Prayer. Just to reinforce that, young people are here to serve. We have a lot of expertise. We pulled together the research on how COVID-19 is actually affecting young people. Call on us and invest in us, and we'll do the research for you. Honorable Speaker, Advocate Jacob Mudenda, the question was on opportunities for young people to participate, to respond to that question.
The opportunities within our parliament have been limited in terms of the numbers of young parliamentarians. I think there are about only 5. But these have been put into various committees of our portfolio committees, and they have made some contributions quite often on matters relating young parliamentarians. We did send one member of parliament seated next to me here, Honorable Vegetal, to an international conference representing our young parliamentarians in Zimbabwe on the issue of leadership and how young parliamentarians can have a voice in the decision-making processes within and outside Parliament. We thought that was a good gesture, and we hope findings from this seminar, which took place in Mexico, and I hasten to say that the Parliament of Zimbabwe was the only one able to send a young parliamentarian from Africa to this seminar, which had been organized by the IPU. Related to that, in our delegation to the Inter-Parliamentary Union, we have a youth who does attend the Youth Bureau under the IPU. And in the 8th Parliament, one of our young parliamentarians was in fact a chairperson of that Youth Bureau. And his experiences in those conversations at the IPU level have been very instructive to our parliament. To increase the opportunities of the youth within our parliament, we currently have a constitutional amendment number 2. Among the proposed amendments is to have a youth quota in our parliament, effective from the 2023 upcoming general elections. We think this is a positive move that will help strengthen the voice of young parliamentarians within our parliament. And I'm not sure whether you want me to talk about research as well.
Well, actually, Honorable, you can actually end there. That sounds very good. We also have some very burning questions that keep flooding, so I'm trying to get as many as we can. So allow me, thank you very much for your responses. Allow me to ask Honorable from Seychelles a specific question that has come your way. From, please pardon my pronunciation of his surname, from John Real, I think. So I said Seychelles will be going into a presidential election this year, and political issues take priority on the order paper so that political parties can gain political mileage during the parliamentary debates. What will you do in your capacity to help the members of parliament to push SRHR issues on the agenda? That's directed to you.
Primrose, thank you so much, and I'd like to thank the honorable member. I was actually anticipating such a question. Of course, I'm excited.
Okay.
This is my second year in my speakership, and I've been waiting for that because this is an issue that we discussed way back in the 4th Assembly. Now we're at the 6th Assembly, and I want to see that. I want to see those motions coming in the House because that will spark interesting and heated debate. Like I say, topics are still taboo, but we need to move forward. We've tackled part of it in the Civil Code. It was interesting debate. It would be good to have, to listen to members actually, because these are issues where some members can be very passionate about. But on my side, once I will push from today, I will push for us to get a date very, very soon to do the last meeting with the stakeholders And as soon as they're ready, they've written the motions and sent through the clerk's office. I will make sure the motions will be on the order paper, and we will deal with the debate before the elections. The election is scheduled for October. If everything is in, wow, okay. Geneviève has just given me a little note now in the sense in that meeting to discuss organizing the next stakeholders meeting is today. So the committee is actually meeting, the parliamentary committee is meeting tomorrow to organize that. I will give them 100% support. And if we can get this out of the way June, July, even before end of July, we'll get the motions on the other people. So I will give the committee, parliamentary committee, full support. I thank you.
Thank you very much. I think we can hustle two very quick questions, and then I'll ask you both to respond under a minute, respectfully. So one of the questions is actually related to young people living with HIV and AIDS. I think as someone who actually also works with, traditionally marginalized groups, it's of interest to me to hear a response to this. So Rama Salomon Humane from Tanzania asked if she would like to hear from honorables more on coping mechanisms and interventions to young people living with HIV and AIDS, specifically during COVID-19 and its elements, lockdowns and quarantines. And then the second question is from the Secretary General, actually, of SADC. She's asking if honorables can share how they will protect the interests of young MPs, if at all, since the role of the Speaker is sacrosanct to both sides of the House. The Speaker is the epitome of impartiality and enforces the standing orders against every MP, irrespective of his or her party. So how will you protect their interests? Very quickly, within a minute to you both. I will start with my fellow brother, Honorable Speaker, Advocate Jacob Mudenda.
The question of the management of HIV/AIDS during lockdown is problematic to the extent that we have our foot soldiers, that is the medical staff, the doctors and nurses, who are extremely under pressure in hospitals and certain clinics throughout the country. Perhaps what we can do is through our portfolio committee on health and childcare, engage them to interface with the youth and see how best we can come up with a strategy to mitigate the challenges of HIV and AIDS among the youth. The second one, interesting young MPs. Well, I brought with me here two young MPs sitting on my either side. And before we came into this session, I did appeal to them that they should come up with a motion that will, in fact, address itself to the Tshwane Declaration and the issues that have been raised during this interface. I look forward to some robust debate arising from that motion in the House. As far as that motion is concerned, we'll make sure that it has got precedent on the order paper. Thank you.
Thank you, Advocate, for being very, very brief. I'm sure you'll copy a few notes from Honorable Speaker Mudenda and briefly respond to the two questions. Honorable Speaker Nicholas Prayer, over to you.
Okay, thank you. Briefly, like I said, we didn't have lockdown, complete lockdown. We had only restrictions. So all our services continued to operate, but at 6 p.m., everything, we went into sort of a curfew. All medicines for like HIV, AIDS, and so on, actually, the patients actually who are being treated in the different programs, they obtained their prescriptions through pharmacies, and all pharmacies across the country remained open. So they had access at all times. We didn't have any problem of confinement or not for them not being able to have access. Now, with regards to young MPs, again, I would say, I witnessed and I have worked with the last cohort of the young National Assembly members for the last year. I even invited the youth speaker at the IPU plenary in Serbia last year, because again, for us to give them, to expose them, for us to try to start preparing them for the future. And I would like to say that I'm actually very optimistic, because what I saw last Saturday, and even in the new cohort, and I'm pushing them, we will have young MPs soon standing either, if the parties don't take them on their platforms, they will probably go for as independent candidates, and they have potentials. This is something I'd like to encourage, and of course, to see youth participation in policymaking of the country. I thank you.
Thank you very much. We have just gone 3 minutes above time. I think that's very good, actually. We're not way off. This actually brings us to the end of this session on interventions by the honorable speakers. So thank you very much. Just to mention that I got messages in the private chat with young people applauding you of the work that you're doing and having appetite to continuously engage with such an open parliament, which is very impressive. They're suggesting Twitter chats and other means. So we will definitely be in touch to actually continue these conversations. And we sincerely apologize for not having managed to respond to all the questions, but I assure you that almost 90% of the questions that were asked were responded to. So I will hand over the mic to Madam Secretary General for the SADC PF Parliamentary Forum, Ms. Boyamo Sehoma. Thank you.
Thank you very much. I think a round of applause to the honorable speakers. It's just that the mics have been muted. Just to quickly, before I hand over to Mr. Hussein Molele, the Vice President of AfriAN, Eastern Southern Africa, to give us closing remarks, to basically appreciate the sterling work that has been happening behind the curtains. We have had, UNESCO, UNFPA, UNAIDS, Restless Development, APHRC, and AfriAN working very closely with the National Assembly of Zimbabwe, the National Assembly of Seychelles, and that of Malawi to make sure that we have a fruitful engagement for today. With that, I'd like to appreciate the work that has been done, and for the SADC Parliamentary Forum, this is what we really appreciate. And indeed, parliaments are open. Honorable speakers are available. Members of parliament are accessible and available. And therefore, we must get to know more about parliament so that we are able to access them and engage them further. You have noticed that there are secrets that we don't know, that are only known by the honorable speakers of parliament, because they see everything from both sides. And maybe we need to engage them in sharing some of these things in scholarship before they take them to retirement. I hope that this is something we'll consider in this platform as we continue to collaborate with all the partners. At this point, allow me to give room to Mr. Hussein Molele to give the closing remarks and the way forward. Thank you.
Thank you so much. Thank you so much. Honorables, speakers, members, and my dear young people, to all. So allow me to start with a deep appreciation for the SADC PF for the adaptation of Tshwane Declarations of Youth in Daba, which was on last year in Namibia and during December. So that's typical show their commitment on supporting the work and promoting the sexual reproductive and rights for the adolescents and young people across the regions. So that's really set a groundbreaking on how best we can amplify the voice of young people and this in these issues. But also this, we've been having a very tangible discussion over the past time, and has been set a very good remarks and background on how best we can move forward from the discussion we've been having. But also this is to sensitize on the following things. First, I will have to be working in using more innovative approaches on how we serve and meet the needs of young people. We've been able to hear from the COVID-19 survey, young people suggesting various key issues, such as using animations, such as using friendly media programs, on how best we can reach our fellow young people in timely and in a way that it can be accessible to them. But also this is a call to both parties as young people and members of parliament and policymakers on how we can work more in partnership, because this kind of issue that we've been discussing and talking are very vital. And we have to work in partnership as we can utilize resources, but also as we can utilize our different expertise. So at the end of the time that we can reach the common agendas as togetherness. But also, this goes also to remind ourselves with each other, when we are doing our programming issues, we have also to take in consideration on how best we can engage and reach the marginalized group, especially the young people with the challenges of disabilities also. On taking note to that, and also I would like to extend our deep appreciations to our different partners who have been able to up such as UNFPA, UNAIDS, UNESCO, these kind of agendas has to divide to we have as we go with the thing that we say we should leave no one behind. But also, as on topping on what our dear Honorable said, I would like to quote on what His Honorable Madam Veronica Macamo, the Speaker of Mozambique and President of SADC PF. I remember when we were presenting the Tshwane Declaration, it's adaptation in last year, she said, youth are the treasure of our countries. So that's really got me on my mind and my head up to now. And so she was amplifying and sensitizing that as we are talking about the agenda of Africa that we want and the agendas of Sustainable Development Goals, the key part of having successful implementation of these agendas are putting young people at the center of implementations, are putting young people as an active partners on implementation of these kind of agendas. So that really entails on how best we can engage with young people and how best we can work with young people as active partners. And topping of that, our hands are open. Young people are innovative. Young people are eager to learn. Young people are taking, but all we really need on many of these agendas are put in place. As for winding up, I can say thank you to everyone who participated on this. And I think this is not the end of what we've been discussing. This is just the beginning, I can say, of the whole road ahead of us on coming with the various initiative, on coming with the new program of action, coming on how best we can really hold each other hands and move forward with these agendas. Let me wish my case here and let me say thank you everyone for their time and participation, and looking forward for more active interactions. Thank you so much.
Thank you very much.
So this comes to the end of our sessions, today's session. Hoping to see you very soon, and let's have a productive week all ahead. Thank you once again.
Thank you.
Thank you. Bye.
Bye.
Thank you. Bye.
Thank you. Thank you.
Bye. Thank you, everyone.